Dr. Donald DeFabio, and it's time for your clinical rounds tip for our ANJC members. With me is Dr. Matt DiMond, who's from the University of Bridgeport. Matt, you teach up there with the students, and we were talking about a tip you give the students to reinforce their documentation, just in case an insurance company wants to find out, hey, why are you doing that, doctor? What was that tip that you have your kids do?
Yeah, so in our new world of insurance requirements, always looking for the best evidence for care, treatment, diagnosis, dosage, right?
That's what we're looking for. We know they're looking for something else.
Right. So when it comes to really justifying what it is that we do with our patients, there's a tremendous amount of evidence that exists in the world. Well, rather than taking a reactive approach to things, let's take a proactive approach. Instead of waiting for them to come knocking down our door and saying, where's the research? We beat them to the punch. One of the things I request my students to do is with every new patient, every new condition, they have to do a research article review, find a pertinent article for that case, and then they actually cite it in real time in the document for the patient's note. It actually becomes part of their note. This way, it has a timestamp and everything the same way as if you had signed off on it. So there's no going back and second guessing yourself. What's actually starting to develop as part of that process is we're getting more and more literature as it supports the different ways that we're treating patients at the University of Bridgeport, and the students now have a small library of evidence that they can draw from as it applies to different patient conditions, presentations, treatment strategies, and it's becoming a very good approach to patient documentation.
Yeah, and I love that. We're being proactive. So in other words, that patient comes in, you get a reference article, put it right in the note. And yes, it takes a few minutes to do a search, but you don't have to do a meta-analysis or a systemic review. You just need one or two articles, or even one, that shows that what you're doing is referenced. And then, I guess if an insurance company does ask for your notes, what do you think they're going to do?
Well, my hope, I don't have any personal experience here, but my hope is that when they look at documentation that is already annotated and vetted with current evidence, having taken that very proactive approach is really going to dissuade them from pursuing anything against your documentation. They're really looking for that low-hanging fruit, right? So if your documentation standards are above and beyond, and they're already integrating the best approaches, clinical guidelines, best practices, you know, these are not going to be doctors that insurance companies want to mess with.
There you go. That's your tip. A little bit of extra work, but guess what? When insurance carriers want to challenge your notes for medical necessity, I think that's a take-home tip. Dr. Madon.
Absolutely, and good luck.
Yeah, that's going to be great. Thanks a lot, and we'll see you on the next clinical rounds.